Hello, I'm Dr. Sudhir Mukherjee. Today I'm going to do this video because of association of a chest pain along with heart attack. Actually, this video is for those who thinks that every chest pain is actually a heart attack. It's not like this. You don't have to worry all those times whenever you are having chest pain. Well, to start with, I would like to say that chest pain may be of different origins. It may be from the muscle overlying of your chest. It may be from the ribs, from your chest. We call the inflammation of this person, we call costochondritis. Apart from that, you may have a chest pain due to underlying lung causes, pneumonia. You may be due to inflammation of the pleura, the cover which covers the lung, the pleuritis. Okay, you may have a chest pain from simple infection. You may have a chest pain from other reasons, from the back side of your chest wall also. So there are a lot of differentials of chest pain. Apart from chest itself, you may have this chest pain from any abdominal region abnormalities, like if you have indigestion, if you have acidity, if you have inflammation in the gallbladder, if you have inflammation in the pancreas, so gastritis, a lot of reasons are there. So how do you know that this chest pain is serious in nature and you have to see a cardiologist? Well, to start with, a chest pain which is not typically localized. That means you cannot localize the chest pain in a particular region. That, oh my god, I'm having chest pain in this region of chest only. No, not like this. A chest pain of cardiac origin usually not so localized. It may be diffuse in nature. Second is, this chest pain is not like a sharp shooting chest pain, like a pinprick sensation or like a stabbing sensation. No, it likes a heaviness. You'll feel a heaviness, you'll have a suffocation, you'll have something is constricting, compressing, squeezing your chest, just like you are having difficulties in having your breath. So that is the thing. So a constricting nature, heaviness of your chest, these are or squeezing nature of your chest is much more important rather than a localized sharp shooting chest pain. Second most important thing is the radiation of this chest pain. Most of the time you'll have this diffuse nature of the chest pain to be radiated from one place to another. Most of the time you already know that it radiates to the left side of your upper arm, to the ulnar border. Sometimes it may radiate to your upper jaw, sometimes to lower side, sometimes to back. So this is the one of the very characteristic chest pain which suggests underlying cardiac disease. Thirdly, this chest pain usually arises whenever you are doing any kind of stressful work. Maybe it is any kind of exercise, maybe you are any stressful situations, maybe you are any emotional outburst or stress. So any kind of stress that aggravate this kind of chest pain is suggestive of any cardiac origin. And most importantly, when you stop this exertion stress, this chest pain usually subsides, this chest pain usually goes. So that is another retrospective evidence of any chest pain of cardiac origin. Sometimes people can take sorbitrate, 5 mg sublingual tablet. We often hear these things that yesterday I had a chest pain, I took this and it gone. Okay, so this medicine is actually for chest pain with cardiac origin. We call it angina. So if your chest pain subsides with this tablet also, that suggests you immediately visit to any cardiologist for further evaluation of your chest pain. So these are the three things that actually suggest the chest pain of cardiac origin. First of all, the nature of chest pain that I have already described to you, that it is not purely localized, is it diffuse in nature, and typically retrosternal, that is the mid version of your chest. And secondly, the most important thing is the nature of chest pain, which radiates to particular region from the left side of your upper arm to the back, even to the upper region of your chest, to the lower region of your chest. And thirdly, the third most important thing, that it comes with exertion or emotional stress and goes down with your rest or any medications like sorbitrate, the sublingual nitroglycerin. Well, I must say, sometimes patients feel severe chest pain when at rest. At that time, it is almost presumptive that you are having unstable angina. That means an angina, chest pain of cardiac origin, which is of much more severe nature than I just previously described. This kind of chest pain mandates you to visit any nearby hospital setup as urgently as possible. Okay, easily this chest pain of cardiac origin persists more than 20 minutes and relentlessly. It actually increased in nature, increased in intensity. At the same time, the duration also increases. And most importantly, it does not alleviates by taking subnitral nitroglycerin, sublingual nitroglycerin, or taking rest or lying down. So these are another categories of chest pain which mandates you to go to nearby hospital as early as possible. But for now, for today's, we are concentrating on stable angina, chronic stable angina, the chest pain. Okay, so you have to remember these three things. If you're having this kind of chest pain which is not properly localized, which can radiate from one side to another side, and which comes with stress, exercise, emotional stress, and goes down with rest or taking nitroglycerin tablet, then it is most likely to have cardiac origin, and you have to visit any qualified physician, qualified cardiologist for further evaluation. Okay, so today's for now. The next I'll be coming with another one. Till then, chillax, relax. Thank you.